AIDS.gov is at the 2014 Conference on Retroviruses and Opportunistic Infections, or CROI, in Boston, Massachusetts. We sat down with Dr. Carl Dieffenbach from the National Institutes of Health to discuss highlights from the conference.
Welcome to Conversations with AIDS.gov. I'm joined by Dr. Carl Dieffenbach from the NIH, and I'm Dr. Ron Valdesari from HHS. And I wonder if you could share with us, Carl, some of the highlights of the scientific presentations that we heard today at the Conference on Retrovirus and Opportunistic Infections, otherwise known as CROI.
Sure, Ron. You know, one of the great things about CROI, it's been the major meeting for the past 20-some-odd years. And you can always count on CROI to have some of the newest findings in the area of therapeutics. That's why this is a very important meeting for the HIV-positive people in the United States. This meeting is no exception, as I was saying. There are three fairly significant findings that were reported out today that I think are worth mentioning to our blog and video blog watchers. First is Merck reported out a new molecule, a new drug that looks very promising in early clinical trials. It looks very safe, really good profile in terms of safety all the way across the board. Again, early days, and that will advance into advanced clinical trials over the next couple of years. The other, it was an important strategy trial where we took the best of the new drugs that have come out over the past couple of years, put them all in combination, and essentially put them head-to-head. And out of that, one, on the basis not so much of the antiviral activity, but on the general acceptability and safety of this new regimen based on an integrase inhibitor plus our standard backbone of tenofovir and FTC. So that's going to be an important new armamentarium for people that have issues with the existing standard first line. So this will be good. It's really good for patients.
More options.
It's really, it gives a new option, a really important new option. You know, there's an issue with efavirenz with pregnancy. This really gives an option for a lot of people.
Good.
And yesterday when we filmed this event, we talked about long-acting antivirals as a possibility that gives us a way to reach to new heights in the future. And we talked about the use of these agents in prevention. Today, the companies and the investigators who are studying these long-acting agents laid out their agenda for how these compounds will advance into therapeutic use. So while it's still early days on this too, the notion of the trials and the studies are designed now to combine a couple of long-acting agents. Well, so what was reported today specifically is the pill form of these drugs together are incredibly safe and effective in people. Now when we put them in an injectable form, can we get to a point where we're giving the pills not once a day, but injections once a month or maybe even once every 2 to 3 months? So that could be a very important advance. But again, these are early days. This is what's exciting about this meeting. Right. You get to see the possibilities of what could be.
And I think that you would agree that that potential has implications both for people who are living with HIV, but also the long-acting agents have implications as ways to prevent infection.
I think it's absolutely critical. And as we think about ways, and I know this is something you and I are both heavily committed to, is how we tackle the continuum of care. The notion of these long-acting for prevention allows us as the department to think about creating a continuum of care for prevention as well.
So one very important piece to that. Thank you. This is Ron Valdesari and Carl Dieffenbach coming to you from the 2014 CROI meeting in Boston.
For more information on the conference, visit CROI2014.org. And for more information about federal HIV programs, visit AIDS.gov.